joining us today out there on LinkedIn. Please hit the like or celebrate button down below. And also, I won't know you're here unless you make a comment, and then I can see you come up on the screen. So please tell me where you're logging in from today. All right, so I'm so excited to introduce today's special guest. I met her a few years back at a conference in New Orleans, and we've been working together ever since. Jaime Paulus, the manager of talent acquisition at Vail Health in Vail, Colorado. Welcome,
Hi,
Jaime.
Leah. Thank you. Thank you for hosting me today.
You're so welcome. I'm so happy that you're here with me today and that we can talk about all the things that we know about talent acquisition. Just to introduce Jaime a little bit more to whoever is watching right now. Jaime has over 16 years of experience in recruiting in the healthcare industry. She is a skilled team builder, a certified yoga instructor, an avid outdoors woman, dog lover, mother of two, and all-around joy bringer. So welcome, Jaime. I'm so happy to have you here.
Thank you. Thank you for hosting me.
Oh, you're so welcome. So let me just check to make sure, are we online? Rollis and Joe?
Yes, we are. And that long list of things you just said, I think it deserves this one right
here. So weird, but it's okay. All right. So I'm just looking to see if there's any messages in, if we have anybody that's logged in. I guess it's not coming up on mine just yet. So we'll just get started and they will join us. So Jaime, I want to start off today very intentionally on a positive, uplifting note, and hopefully we can maintain that throughout our conversation. Right. I'm making a concerted effort in my life to resist that instinct towards negativity. And we have a lot of pretty heavy things going on in the world around us. Mm-hmm. So for the next hour, I want us to really focus on solutions and reframing complex issues and approaching this conversation with optimism. So with that being said, Jaime, I want to know what have been your biggest wins this year, both professionally and personally.
Biggest wins professionally, I think, is we have added another recruiter to our team, and she is a joy to work with and is very skilled. Her name is Jody, and she comes to us with a lot of boutique talent acquisition experience, and that was a win, I think, for Tori and I to get to add another person to our team. Professionally, I think a big win for me is I practice a lot of gratitude on a daily basis, and in a world where I feel like so many people's positions and jobs have been affected, I feel very grateful that I have my job and that we have continually been able to hire over the last year, and we still have growth and development plans that are forthcoming, and we as an organization are bridging into another community in the mountains. So I feel like that is a strong win for us professionally. Personally, I feel very grateful for my health, and I feel grateful for my family. I have a 2-year-old and a 4-year-old and a husband, and I can't say enough about my husband. He has as an electrician, and when we have been forced to have our kids at home, he takes over daddy's school, and he is a full-time parent, which allows me to continue to work. And so I try to celebrate simple wins, and I think that I'm so grateful that he is able to take time off and be with the kids. And I think this past year has allowed us to slow down to some degree and to be more intentional with the time we spend together as a family. And while I sympathize with all you mothers that are working from home because your child sees you and you're still mom, and it doesn't matter if you're on a conference Zoom call, I feel like getting to spend more time with them, if that's taking a break and make them lunch, like I celebrate that. And I feel like it's strengthened my relationship with my children over the last year, even though sometimes I'm like, we're not meant to stay at home and take care of our kids too. But it's making me practice balancing, and I guess I'm very fortunate to have a healthy family right now.
Absolutely. I love your wins. I love that you talk so much about your family, because I know that that's obviously the most important part of your life. And, you know, I think that we talk a lot about work-life balance, but I've kind of subscribed to the method of work-life integration, and I think it's
Yes.
even more prevalent now. Like I work at home, and my office is at my home, and my home is at my office, and it's confusing and it's difficult, and there's all sorts of things happening, and so many people are going through the same thing. I don't have kids, but I'm home with my spouse who's also working from home. I have dogs. Somebody just rang the doorbell. I think it was the mailman delivering some kind of packages. So my dog, and it's just, people get it now. And I think that I've experienced a lot more understanding and empathy from other people this year, I think.
Yes.
So I completely agree. And I'm super happy that you take the time to spend the extra moments with your family, because this year has been tough. That is for sure.
Yes.
Yeah. So, go ahead.
Well, I was going to say one of the challenges or something that's come out of all of this working from home is that my 4-year-old likes to play work now, and she's like pounding on the computer and talking. And at first I think I was kind of like, oh, this is not good. But I want her to grow up knowing that, like, my career is very important to me. I was well established in my career before I made the decision to have children. I had my first child at 40.
Right.
So in some ways, I feel really proud that she understands that I work so hard to support our family. And I've tried to spin that on a more positive, spin it positive, as opposed to, oh gosh, my 4-year-old likes to play work now.
I wonder if that's going to become, more prevalent for all sorts of kids. Like, and they, play on their computer, but they're all on school online, right? Like a lot of kids, your kids probably aren't yet, right?
My kids aren't, because they're in daycare and they're 2 and 4. But yeah, most of the kids here, they're, as each week goes by, we continue to see schools shutting down, and a lot of parents do have that remote option. I think when this all started in March, I was like, am I lucky that my kids are so young, or am I fortunate that they're not in school? I don't know. The grass is always greener. I think for my kids, it's been a challenge because they, don't understand masks, and I had to teach them what social distancing meant, and that was very hard for a 2-year-old and 4-year-old. They just want to
2-year-olds
hug everyone,
like personal space. So
right, they hug everyone, and it was heartbreaking when this started, and my daughter said, "Can I hug her?" And it was her aunt. So that has been a challenge too. They are learning facial expressions at their ages. So the masks are, a challenge because of that. I think you smile with your eyes, and we're limping through this as everyone is.
Okay, that is weird, because whenever I'm at the grocery store or somewhere and I'm like trying to smile with my eyes, I like over exaggerate it, and I think I'm being smiley, but Adam's like, you look really weird. It looks like you have a question, or it looks like you're frustrated. He's like, I don't think you should do that. I think you should just nod your head and like, welcome, or like, because apparently if you cover up this part of my face, I look like crazy when I smile.
You don't, Leah, you don't.
I look a little crazy. And I get it. Facial expressions with a mask on are difficult. That is for sure. So I guess moving on, what I wanted to know from you after talking about your wins is more about what you do at your position at Vail Health. Like, what type of recruiting do you currently do, and what is your position there?
So my position is the manager of talent acquisition, and I have both Corey Stevenson, Jody Weiserhorn on my team. We recruit entry level, so any patient access reps, environmental services workers, all the way through to all of our clinical positions, be that RN, radiation therapist, rad tech, all the way up to more management positions. We recently brought on a new VP of revenue cycle, which is a new position for our organization. So all of us are capable of doing any of those roles. And we do.
Sorry, go ahead. It just came up on the screen. Yeah, it was like a playback. I'm sorry. Keep on going.
No, so
I have a couple questions for you.
Of course, we do the whole facet of recruitment. Recently, the 3 of us in the last week had to open up a new COVID clinic. in Frisco, Colorado, and the three of us successfully hired 15 individuals in a week to get these new clinics up and running. So we do everything.
Incredible. That's literally, I mean, when you were telling me about that, like to stand up a clinic in less than a week so that people can get tested and get treated and triaged, basically to be in your hospital system in a completely new location, because you don't have an existing location there, do you?
Correct. No, we have plans of expansion into Frisco, and we currently have some doctors' offices there. But no, this is the government there in Frisco asked for our assistance, and this is many people besides talent acquisition. Chris Lindley, who's our epidemiologist, and also over our behavioral health. We opened up a new behavioral health in the last year, and his team's been amazing, and everyone's really come together. We have VPs over there testing people because they wanted to open on Monday. We had the majority of the people start today. So everyone has really, one of the things I'm most proud of is how everyone's come together in this time of crisis to work towards our organizational goals.
That's incredible. I mean, I know how hard you and your team work in recruiting, and you recruit for every service line in the hospital. Do you guys recruit surgeons, or is that a different service?
Great question. We work with two primary orthopedic groups, the Stedman Group and Vail Summit Orthopedics. So they're not currently our physicians or employed by us. But for our new location in Frisco, we are opening a Shaw Cancer Facility, and we will be recruiting a medical oncologist physician for that. So historically, Vail hasn't employed their physicians. Things are changing right now. We will be employing all of the trauma surgeons within a week. So that is also changing.
Wow. I know that when you tell me that you're got a lot going on and you're stressed about work, like I know you hire a lot of people, but I guess I never truly understood how many people you hire on a weekly basis or what you're doing, and that you and your team of two other people, so a team of three, yes, are responsible for the entirety of the organization and bringing people on. Do you have other people in your HR department that do your onboarding?
So yeah, we all share in that responsibility, and our team, Amy's been there 8 years. Cherie's been there, I think, maybe 8 or 9 years. I may be butchering some of this, but we have some tenure on our team, and we work great on our initiatives and our goals together.
Okay, that's so. I can finally see this. So it wasn't working for me to see the comments and everything, but we have a lot of people watching right now. There's people that actually want to hear from us, which is wonderful. So Sean Hatcher, he's here joining us.
Hi, Sean.
Oh, you know Sean, you met him in Houston, from Raleigh, North Carolina. Patty Witt is here. Ilja Thomas is here. He is in Europe, I believe in Switzerland.
Oh, amazing.
I know, isn't it crazy? Joanna is here. And you just met her little girl today.
Yes.
Over Zoom. We have, let's see, there's a couple other people in here, and I'm missing some of the comments, but I just wanted to say thank you guys so much for joining us. And if you have any questions for Jaime about what it's like to live in Vail or recruit for Vail Hospital or recruiting in a rural area, please drop them in the comments, and I can ask her those questions.
Of course.
So moving forward, yes. I want to ask, okay, so you told us about your job and about the positions that you recruit for and kind of your team. How would you describe your job to a 10-year-old?
That's a great question. I would say that my job is to hire the best and most talented people to take care of people. That's how I try to describe it to my children, is that we are fortunate. I feel fortunate. I get to meet amazing people every single day. And for the last 13 years, specifically at Vail Health, I love the people that are employed with us. And I am proud to be able to hire these amazing clinicians to take care of our patients and provide exceptional patient care.
Yeah, that's perfect. You hire wonderful doctors and nurses to take care of people, and everybody else at the hospital that works to make sure that the hospital is open.
Yes,
So,
from entry level to a physician, we need all of them to provide exceptional patient care.
so were you the type of person that wanted to be a recruiter from the start?
No, I think I don't really know how this career fell into my lap. I guess in college I went to college for business and sociology, so I've always loved studying people, and I think that I am outgoing and I love going places and talking to everyone. Everyone has a story, everyone has a passion, everyone has experiences. So it just kind of happened. And I haven't ever looked back. I can't imagine doing something different. I don't know what it would be.
Well, you're really good at it. We know that.
Thanks.
So what was the first thing that you wanted to be when you were a little kid?
That's a great question. I think, we grow up really thinking that there's just nurses and doctors. And one thing I'm really proud of from our healthcare organization is how they bring in the high school students. And this is one of my coworkers, Robin Sobieski. She helps partner with marketing to bring in high school students to show them all the different jobs that we have here. And I think it's so important because I don't think that traditional be a nurse, be a doctor, that doesn't work now. So one thing that we're doing is we partner with this group called CareerWise to do internships at our on our campuses, and it's such an amazing program there because they do it throughout high school and they're getting to learn all these different jobs. We have people right now in diet as a dietary aide, and they're delivering the meals to our patients. So I think I probably wanted to be a nurse and then found out there's such a different way to still be impactful and help people. I'm not really a blood person. I did some volunteer work in Africa where I helped deliver babies, and that was a very stomach gut-wrenching thing for me because I don't feel like I would have been a good nurse because they asked me if I needed to sit down because I think I went ghost white and almost fainted. So this allows me to feel like I impact our health system and our community and makes me feel proud of what I do, but I just don't think I'm really one of those blood and guts type of people. I almost passed out at my own labors.
That's hilarious. So I knew that you've been to Africa, but I guess I didn't realize that that's the type of volunteering you were doing. And that was in Tanzania?
I've been twice. I've been to Ghana and to Tanzania. Both were different. One was more medical, and I went with a group of people from Vail Health. And yes, I was fortunate that I got to deliver babies. Obviously, healthcare is very different there. The first time around, I was helping in the schools and teaching English, and we also did some construction work. But yeah, I've been fortunate enough to go twice now.
That is amazing. That is.
Yeah, and I have to thank my amazing where I work because they allowed me, we have a very generous PTO policy, and they allowed me to obviously lump it all together and to exit for a month. And I feel so fortunate because I think those types of programs really make you come back with fresh eyes and feel I had energy and just so grateful for how we live here and how fortunate to have water that comes out of a tap, and I could go on and on. But yeah, those are some of the amazing things that I've gotten to do. And we have now implemented a corporate volunteer policy at Vail Health, and it benefits our community. We don't, unfortunately, let people go abroad, but they can go for a week and volunteer at an organization of their liking or their choice, and we will pay them the same amount that they would normally make for a week at work. And I just feel like sometimes them taking a break, if you're a clinician or not, and just seeing something else makes you come back so much more energized.
I think you're so right. I used to work in corporate social responsibility before I moved into law and then into HR and talent acquisition. And that was one of the biggest drivers of motivation for people. And I know a lot of companies have or company matches, they'll match your donation. And what we heard back from people was, yeah, I like that you match my money because that's helpful. But what I really want you to do is give me the time to donate my time to these organizations. And that was so powerful. These individuals were able to go and volunteer their time at hospitals, at environmental locations, at I think there was some library stuff. We built houses. We did all sorts of really awesome projects. And what happened was we were able to build a program around volunteering, and getting other people from your own organization involved in the organizations that you support outside of work. And it was so rewarding, and people truly, I couldn't believe how thankful people were, that they were like, oh, thank you for letting me do this as part of my work. Thank you for helping me find this type of volunteering opportunity, because volunteering opportunities are sometimes kind of difficult to find and organize. And if you don't have a lot of time to do it, it's kind of cumbersome. So having that available through your own place of employment, that is amazing. So what I want to ask everybody that's watching, I think Rawlis and Joanna are keeping track of all the people coming in, and thank you guys. Welcome for anybody new joining. I see a couple more people on. I'm talking today with Jaime Paulus from Vail Health, and I just asked her about what she wanted to be as a child. So I want to know what other people wanted to be when they grew up. Like, I know I hear like rock star or astronaut, or I always thought the same kind of thing, like marine biologist. I wanted to be a news anchor for a while because I was like obsessed with the Today Show, oddly. I also wanted to be a pediatrician. But it for me, when I was a kid, it was like every time I learned about a new thing, I was like, yes, that's what I want to be, But this is coming from a kid who grew up in a tiny, tiny town and didn't really know much about anything. So,
yes, you did.
No, I was talking with my friend the other day. I didn't know people lived in apartments. I thought when I was a kid, apartments were only for single adults. Like either you had to be in college or not married or like an elderly person to live in an apartment, because the apartments in my town, like there's 3,000 people there. The apartments in my town, kids didn't live there. It was, assisted living. So I thought that was no kids grew up in apartments. And then, you watch a TV show and I'm like, there's kids who live in an apartment? Like, where's their backyard? I was not the brightest. Okay. I was very sheltered, we shall say. So Rawlis is making fun of me because he says now I am a news anchor. This isn't exactly hard-hitting news. We're mostly just talking about talent acquisition. So same, I guess. One thing I wanted to ask you is what are three issues that make recruiting super difficult to your specific facility or to your specific location?
3 issues that make it difficult to recruit to our location. Well, we are a very rural healthcare facility that's located 2 hours west of Denver, and we get 6 months of snow accumulation. So that has its challenges too. There's not a mall here. There's not some of modern day conveniences that some people like, oh, I need to go run to TJ Maxx, or I need to run to Target to get something. That takes planning because you have to utilize the metropolitan cities on either side of us. So it's not a quick jaunt. People have always said, is it hard to recruit there? And I don't necessarily know that it's hard. I think it's hard to find people that want to stick, that really want to leave their metropolitan areas and come here where there's no traffic and there can be inclement weather, but there's amazing outdoor life that exists here. I originally was in Denver right after college, and I would drive up here to go fly fishing and camping, and I wanted that lifestyle all the time. So I think that right now, something that's changed, I think, recruitment is that more people that are living in New York and California are wanting to live here because they are wanting to get away from the congestion of people. And maybe that's for many different reasons, but we've seen an influx of people moving here, which I think has made recruitment amazing for us because we have many more applicants than we're accustomed to. So I think our rural location is a challenge. I think, having to go drive 2 hours to a sporting event or a concert can sometimes be a challenge. But I just think it's finding the people that want to go fly fishing after work or go snowshoeing at lunch. And they're coming here right now. I think that all of my real estate friends have said, wow, real estate is just really going crazy here. But I also think that's the remote workforce. And I'm
Yes.
so fortunate that so many more people are working remote, and our organization has really changed their philosophy on that through this COVID thing. And, we hired many COVID schedulers, which is an entry-level role, be remote for us. So I'm really proud of how we're adapting to some of the current challenges in the workforce right now. I'd say that something else difficult is the cost of living here. Obviously, I think the biggest misconception is that we live in Vail. If anyone's visited Vail, we don't live there. We tend to live in the surrounding communities. So I think that's another challenge. I think people like myself who wanted a family and wanted a house, that presents some challenges too, because as all these people are moving in, there's not much housing available for our employees. And something that Vail Health does, what I never heard of, is that they will put people up in temporary housing to take away some of the stress of relocating here. And that can be for a period of a couple months to 6 months to really allow them to figure out where they want to live, because each town is so eclectic and unique and different. Minturn, Eagle, Avon, Edwards. So I think that speaks volumes about how they really want to help people transition to a new employee opportunity, and that they're trying to remove some of that stress, as well as paying for relocation, because we understand how challenging it is to move across country. We recruit nationally. So, a lot of people will say, oh, don't you pull a lot from Denver? Just now with what's happening with COVID, we have, I think there's so many people, I think, down in Denver that are like, I want to be up there. There's no traffic. We don't commute to work. So I think those are the three things I would say.
And so I want to ask you about the 3 highlights that make recruiting to your facility just like an absolute breeze. And you kind of went over those, but I think you're right, Jaime. I think that, we're seeing a big shift from moving from those more urban, very concentrated population centers. Yes. People find like the possible silver lining of us going into a very fast quarantine and lockdown period at the beginning of this year is companies across all sorts of industries realized very quickly that employees don't necessarily have to be in the office to be great employees.
Yes.
And it all of a sudden allows organizations to be far less centralized in a certain location. And hopefully, this sticks. And I think it will. I think part of necessity, it's going to have to stay for a while, the work from home or remote work, or like the hybrid type of schedule where you go a couple of days and whatnot. So I think that's going to stay. And earlier this week, I was listening to a podcast, and they were talking about how the 8-hour workday was actually created by one company, by one man, by Ford. And it was created in the 1930s, I believe. I should know this. This was part of my master's thesis. I know this stuff. But it was because, he created this assembly line production, and it was 8 hours of sleep, 8 hours at home, and 8 hours of work. And that was what worked perfectly for the maximum output for his workers. And then it just stuck. And for some reason, all industries are like, yeah, we'll adopt that. 8 hours sounds great. And it's like, wait a minute, that doesn't make any sense for a lot of industries. And so now we force people to sit at a job for 8 hours that they might be only productive for 4, and then they're like wasting their time for another 4. So I think that we're going to see a lot more flexibility in time, in scheduling, in where you live. And so hopefully that encourages more people to look at places like Vail, Colorado, as a real place to put their family and work and live in a wonderful life.
I hope so. I can tell. I definitely think our organization offers flexibility with different shifts and schedules, and I know for me, I obtained my yoga certification while employed at Vail Health, and they were so supportive. And Tori just obtained her Pilates certification while employed with Vail Health. And so for me, I entrust in them to get the work done. And as recruiters, sometimes at night is the best time to be working because we can get people. So I just think that Vail Health does offer those different schedules and flexibility. And it's another reason why I've stayed as long as I have.
Yeah, no, I think that whenever I tell people about working with Vail Health, about being, your partner for HR and for recruiting, when I tell them that your organization has housing, they're like, wait, what? A hospital offers housing for people? I'm like, yeah, they buy in. Like if you were going to work for them, they support you from the very front end, from the very beginning. And I think that you guys create a great employer brand and a great work culture because you do those things, because you commit to those people. So really quick, before you tell me about what's easy or the greatest things about recruiting for Vail Health, I wanted to go back because there's a bunch of people that have hopped on and told us some things. So back to what you wanted to be when you were a kid. And I love this question because I think, it's interesting to see if people, live out their dreams as a kid. So Patty Witt wanted to be a fashion designer. And I believe Patty Witt is not currently a fashion designer. Correct me if I'm wrong. But I bet you would be a really good one. Joe wanted to be a social worker. That's interesting as a kid. Or an interior designer or a fashion designer. And Patty Witt says, I don't think fashion designers live in North Alabama. No. Yeah, probably not. I mean, maybe
now.
Yeah, who knows? Ilja says, long story, but my first dream, so to speak, was to become a Formula One pilot. Is that like a Formula One driver, like race car driver? That's a pretty cool dream. Sean Hatcher wanted to be an astronaut. And you know what? I actually know one person. I went to school with her from the time I was in preschool who wanted to be an astronaut, and she literally works at NASA. I got to go visit her a couple of years ago, and she's not an quote unquote astronaut, but I feel like it's close enough. She works at NASA, and it's amazing.
Yeah, that's amazing.
I know. I got a behind the scenes tour, and it was possibly one of the best days of my life. It was so cool.
That's really cool.
I know. So, okay, quickly, can you tell me the three best things or the three things about your facility or about Vail that make recruiting there just like, yeah, of course I want to work there?
Well, we do live at the bottom of a ski mountain, so we get to go skiing a lot. So I think that the 300 and some days of sunshine doesn't hurt either, because I grew up in the Midwest, so that gloomy gray, it didn't work for me. I think living here encourages a very outdoor, active lifestyle. Like we love to camp and fish. That'd be one of my favorite things. It sounds so silly, but I'm going to say it's the people. When I joined Vail Health, I was interviewing at another very large system, and I came up, I sat in the foyer, and I just watched people, and everyone was smiling at each other and talking to each other, and I feel that culture still exists today, and it makes me so proud to work there. And it's on every exit survey, what's the best part of working here, and everyone says the people. So that's my second favorite. Location, people. The third thing is when I go, I can't function in a metropolitan city. Recently, I went to a city and I was in traffic and I got lost, and my daughter is panicked because she's like, there's so much traffic, we don't know where we're going. I love living in a place that I don't have to sit in traffic. And my friends are funny because they're like, oh, you could if you really wanted to. And I was like, I don't want that in my life anymore. I don't know that life anymore. So I think the third thing is getting to wake up and drive to work and not sit in any traffic. It's not for everyone, but I love it. Those are my favorites.
I 100% understand that. My partner, my spouse, he has saved 73 hours a month of drive time by working from home. 73 hours. He golfs every day now. We live on a golf course. And so he's like, I can just be done with work and I don't have to get in a car for an hour. I just can do whatever I want. He's like, what do I do with all this extra time I have? There is definitely something to be said for living close to where you work. I think it's Tim Ferriss and his 4-hour work week. You know, he gives the ultimatum, like, do you live close to where you work, or do you just find a new job? Because you are giving so much of your life to being behind a wheel. And I used to think about that sometimes, and I'd be like, well, else I can't come to work. I can't do it. But we went to a flexible work schedule because I was spending so much time in a car. And I think that is such a benefit. And I think that you're seeing a lot of people from big cities moving to smaller places because they agree. It is precious time with your family and, you know, things that you could be productive at work. Oh my gosh, guess what? My sister's on from Wyoming. Hi, I'm so excited. She said that she would log in, and she said that she wanted to be a teacher, always a teacher, and that's what she did. But now she is a ethics coordinator for the Boys and Girls Club of America.
Oh, that's amazing.
Yeah, she's super cool. And let's see. Oh, Sean Hatcher said he was super jealous of my behind the scenes tour of NASA. Sean, next time you're in Houston, I will hook you up with my friend that works at NASA. Don't worry. Okay.
My husband, before we had children, tried to get me to sign up to go to Mars. Like, wanted us to sign up like forever. We would never come back. And he's very much enthusiastic about our 2- and 4-year-old going to space camp. And I think kind of trying to influence them that they too want to be astronauts. I have a real passion for NASA as well.
What do your kids want to be? Do they have any ideas at 2 and 4? What
I don't think so. You know, that's a great question. I should probably ask her when she's playing work what she does.
What are you typing? Are you anger typing on that keyboard there?
And I'm a pretty happy-go-lucky person, so sometimes when she mirrors me, I'm like, that's interesting. But I'll have to ask him. I don't know. I mean, probably my youngest, he's 2. He'd probably want to be a trash man. That's the highlight of his week, is watching the trash man come. And he may want to be a teacher, you know. Yeah. They don't love the doctor's office. I don't even know that they necessarily understand that I work for healthcare, really.
Oh, well, maybe they'll learn soon. Who knows? Yeah. I mean, they're little. They're little guys.
They are little. They're very little.
So I know that you guys have the virtual career fair coming up on December 9th.
Yes.
And I wanted you to tell everybody that's watching, anybody that's looking for a job in healthcare or any other healthcare facility that's looking to do this type of advertising or recruitment, tell them about the virtual career fair that's coming up.
I would love to. So we historically traveled to recruitment fairs across the country, and we would meet people and recruit them to come here. And this is something new for us because everything's online, and Leah has been great help introducing us to Zor, who is formatting this online recruitment fair. We are opening up a large facility. We are going to have a surgery center. We're going to have a family medicine clinic. We're going to have, we have a cancer center here in the mountains, and we're expanding into Frisco, so we will also have a cancer center. So this is a very large facility with lots of new jobs, and we're very, very excited about it. And we will host this career fair in hopes to meet and start networking with people that live in Summit County area or people anywhere that maybe would like to relocate. We have lots of positions to fill, and the facility will be opening in September of 2021. We're very excited about it. And so we would love to talk to you and meet you and learn more about you and how we could hopefully find a space for you in our health system.
Yeah, no, the virtual career fair is going to be so cool. So basically, I think by the end of the week, we'll have the link on the Vail Health career site, and you can click, interested in the virtual career fair. And I think on December 1st, we're going to open the career fair. You can basically log in, and it's like a virtual conference center, and you can go to different booths, and you can see, what the pharmacy is hiring for, or what the surgical centers hiring for, and it's all powered by AI. And so Jamie and her team, because remember, there's only 3 recruiters at her facility that recruit for everyone. They don't have to be online. What you can do is you can interact with this chatbot with the artificial intelligence. It gets all of your information and it can put a time on the calendar for Jamie and her team, or you can schedule to talk to them on the actual day of the live event. It is such a game changer in the way that online recruiting is going to be happening, in the way that talent acquisition is going to continue to grow. And I think that even after we go back to in-person events, you're still going to see a lot of virtual engagement. So I'm just really excited. It's a really interesting way to recruit people from all over the United States for these jobs in Vail or with Vail Health.
I'm so excited because I think so much of talent acquisition is just building relationships, and I'm just excited to meet more people, and I think the fact that there will be another entity over there. There is a healthcare system, but there will be someone else, and they have choices. I think choice is so important. So we're just excited to talk to everyone, and if you have a desire to work with us, please let us know.
Yes. And like I said, you'll see that on their website very soon. So I want to ask you some fun questions.
Okay.
So, what is the next place on your travel bucket list?
That's a great question. My husband and I didn't take a honeymoon when we got married. And so we have very much been talking about how we need a trip with us, especially through COVID. Our families don't live here, which is, I think, sometimes a hard thing for people looking to move here because they want their families to be close by. But we have talked about maybe going on a trip ourselves. I'm very passionate about international travel, so this is currently challenging for me right now with the current climate. But there are some places that we haven't been. We talked about, I've been fortunate enough to go to Thailand, and I've traveled a lot internationally, but I haven't been to Bali, and I would like to go there. I'd be happy just going to a hotel and sleeping for a weekend and having a babysitter, quite honestly. But I love Mexico. There's a big, we call it mud season right now, and a lot of locals tend to go to Mexico right now because it's really muddy. The resorts aren't open, and there's just not a lot to do because we're transitioning between seasons, and I know there's a lot of people leaving for Mexico for fall break and stuff, and I would be happy going there and sitting on a beach with a cocktail.
I think that sounds wonderful, like absolutely wonderful. I would definitely do that if I could safely get to Mexico and stay for a couple of months and just work out of there. That actually might be a really good idea. Maybe I'll look into that really soon.
Yeah.
So what is the phone app that you use the most?
That's a great question. I recently, for my mental health, needed to take a break from social media. I still am engaged with LinkedIn, but I just think I maybe did some self-reflection about how much I was scrolling or using it to pacify downtime, and I decided I wanted to focus more on my kids. So I've been off of most media apps. I still do utilize LinkedIn on my phone, and probably my email are the ones I utilize the most right now. Normally it would have been, I'd think, Instagram for sure.
And I would love to know from the audience, what apps are you guys using on your phone? I am always looking for new advice about technology and apps. I have to read this comment because you're going to think this is hilarious. So talking about the kids question. So Jo says when she was 5, she thought being a grocery store clerk was the coolest job ever.
I agree with her. That's probably what my daughter wants to do.
She wouldn't.
And that was actually my first job.
Oh, really?
In high school. Yeah.
Okay. So she says she wouldn't let her parents put away the food until she scanned it on her toy scanner.
Yes, I love that. We play that a lot at our house.
And I actually love the self-checkout because when I was a kid, I loved the idea of being a grocery store clerk as well. Like I thought that like the machine where you gotta, scan everything. And I love doing it to this day at the grocery store. Like if things go south for me, I'm going to be a grocery store clerk.
Now that you're saying that, that's probably the most used app on my phone because I do everything electronic because of COVID, and we do all of our grocery shopping on there. That's not very exciting. This is the life of a working mother.
We've really dropped our ratings here. We're talking about scanning our groceries now. Maybe.
What's your favorite app?
Oh gosh, I look at the news app every day. So yes. I kind of have this like ritual. I read the news in the mornings. I started using. I've been trying to use a lot less social media as well. I basically don't ever get on Facebook anymore because I kind of can't deal with all the craziness on there. I like Instagram because it's so wonderful to check in on people and see what they're doing in their lives. I do watch TikTok because my nieces are on it and they're hilarious and they send me all sorts of funny stuff. And I started learning all sorts of things. I follow some like hilarious people, but also some very helpful people. And let's see, that's probably it. I mean, I use my photo app a lot. I take lots of photos of my dogs. Yeah, that's my life. Okay, so moving on from that. Well, now I feel bad. So do you say that you're more of an introvert or an extrovert?
That's a great question. I think most people that know me probably think I'm an extrovert because I talk to everyone, but by Friday night, I want to be in bed by 8:30 because I think I'm so tired from talking. Well, I mean, obviously our job is to talk to people and make connections. But when you're on all week, I think I retract and become introverted on the weekend in order to refill my cup back up.
I think that's a lot of people. People would say that I'm an extrovert as well, and I would too. But I feel like I'm more in that ambivert. Like I'm a little bit of both because I do need that like personal quiet time to recharge. My partner is a wicked introvert. Like he has to do his alone time, and he's really quiet and I'm kind of like the extra, very extra person here, I guess. But it's so interesting to ask that type of a question. I don't know. Have you ever done like the Myers-Briggs or disc profiling or anything like that about your personality?
Yes. And they're usually right on.
Yes.
Yeah.
Isn't that incredible?
It is. It is. I think I recommend other organizations utilize those so you can help people learn to communicate better with one another because they have nailed those profiles.
Yes, I agree. So Wallace says that he wants to go back to Jamaica and then to Greece and Italy for he and his wife. That's their next place.
Aww.
I know. I want to go to Italy and Greece. I just want to go anywhere.
Yeah, I want to go everywhere. I've never been. I agree.
I just want to go. I mean, like, even London would be fine for me right now. I mean, like, that sounds... Who am I? That sounds so ridiculous. But even...
I think we all just miss travel.
I just want to travel. Yeah, I just really want to travel. Patty Witt says Pinterest, is her very favorite. And she only gets on Facebook to watch videos of Family Feud. That's so funny. I wonder if you could watch it on YouTube. Yeah. I think Facebook is I'm kind of over it for right now, but all my family's on it and I get to see friends from all over. So, I still go back. Anybody else in the comments that wants to answer any of the questions that I have asked Jaime, please go ahead and feel free and I can try to get them on here. Somebody said they use LinkedIn and Instagram as well. I use LinkedIn on my phone a lot, and I'm starting to see a lot more people. I think with more people being at home and like focusing on their careers, and I've seen a lot more activity, I guess, on LinkedIn, which I love. That's where we're at right now. So, do you collect anything?
Oh, that's a good question. Do I collect anything?
Are you like the minimalist that...
I am very much a I try to practice minimalism, and I think that's just spending time doing volunteer work in other places.
Mm-hmm.
But I think when I was little, I collected rocks and shells. Now as an adult, no, not really. I don't think I collect anything. I mean, I like to fly fish, so obviously we utilize a lot of flies, and I love camping. We have a pop-up camper, but I don't really think I have anything like I collect.
Okay.
Ask my husband, he may feel differently.
You don't have like multiples of the same thing.
No, I like knick-knack, paddywhack. I'm not really into that.
Like the kitschy, cute stuff. Yeah.
I like stuff to have a purpose.
Okay, that makes sense. For those of you watching, please let me know if you collect anything. I want to learn about your collections. I somehow got into collecting coins recently.
Oh, that's neat.
No, it's weird, and I don't think it's going to prove to be helpful, but in my weirdness, I started, like, I have a spreadsheet that tracks all the coins I have and their value, and this is what happens when you don't have kids, okay? You do really weird stuff. Adam has a golf club collection, it's absurd. It's absolutely absurd how many golf clubs are in our house, or golf bags. And I feel like I need to get rid of my collections, because I also, one would say I may have a collection of shoes that I don't actually wear anymore, because I basically only wear Birkenstocks or slippers right now. I don't wear anything else because I don't ever leave my house.
No one can see your feet.
I know, like, who cares? Who cares anymore? So, okay, I just saw it. Joanna uses the Target app a lot.
Oh, interesting. Yeah.
You guys don't even have a Target nearby, do you?
There is one in Silverthorne and one in Glenwood. So from where I live, it's an hour this way or 45 minutes this way. So again, intentional planning.
Okay, so somebody asked, Jaime Paulus, what is either your favorite thing to see or your pet peeve when it comes to resumes?
My favorite thing to see, we actually asked the question, like, why do you want to work for us? And that's important to me, because I want to know about you and why you want to come here. My pet peeve, or something that bothers me, is when people don't have their experience consecutively. The jumping around, I probably have some unconscious bias towards that, because I find it confusing. That's probably one of my pet peeves.
Okay. Those ones drive me crazy.
Yeah.
So, Patty Witt says she collects Carnival glass from Indiana Glass Company that closed in the 1970s.
Oh, that's interesting.
Patty Witt, I wish I would have known that. We just did an estate sale at Adam's family's or grandparents, and they had like 3 rooms filled with, I never even knew what Carnival glass was. They had Depression glass and Carnival glass, and it like all went online, because apparently it's like a whole sector of collectors that I didn't even know existed. And it was crazy. It was gorgeous.
That's so interesting.
I know. I think that, that people that collect things are so fun. Like,
I know, I feel kind of boring when I'm hearing all of this. I'm going to start collecting that. Or maybe my sister had this weird collection when we were younger, and I think maybe that's why I'm scared.
Yeah. My grandparents always used to get the magnet from every state, because they like had this big motor home, and they would, like, when they traveled, they would get the new magnet, and then on their refrigerator, they had like the whole United States. It was super cool. I know that a lot of people that travel a lot collect like little things from places, maybe stickers or keychains or whatever. But I agree, I like things to be useful. Mm-hmm. So that's interesting. This is something that we started doing. We buy one Christmas ornament every year, and then like a meaningful something, like, so from somewhere we travel, or something that we did meaningful that year or big, and then we put the date on it, and then it all goes in the same box. So every year when we put those up, we have we're on like year 5.
That's a good idea.
That was fun. I mean, and it's like kind of a tradition and a collection all in one. So, okay, so I have a couple more questions for you that I want to get in. Okay. You know that I love HR tech. I'm like a super weird software enthusiast.
You are.
And I like well-organized software, and I like it to work, and I like it to be very user-friendly and intuitive. Are you using any new HR or talent acquisition technology that you're enjoying?
We are currently using anything that helps with interview scheduling. I think is a great thing to invest in. And recently, we're going to roll that out to the entire HR team, because I just think it's so much easier when you don't have to coordinate back and forth to meet with someone. So I speak very highly of that software.
Wait, what was it?
Like anything to schedule interviews, so Calendly or anything that is going to put ease into your daily activities that you do as a recruiter, I strongly recommend. So the texting too, we just turned that on because I think it's so much easier to get a hold of a candidate via text than a phone call. Those are two things that I would speak really highly of. I have to say, the new thing that you just sent me, Loom. Is it Loom? I was really impressed, and I actually did pause to say, gosh, could this help our hiring managers or directors? Because it's a video of yourself giving instructional. And I think that there's more of that in the near future for talent acquisition as well.
I can help you get a Loom account. It's very simple. And it really, I used to make, I make a lot of tutorials for clients and for other people, or, my employees that I need to show them how to do something really quick. And I used to take screen videos and then send them to them. I had to wait for them to upload and then put them on, a server. I had to put them on either like Google Drive or somewhere. And it takes a long time, but this is instantaneous because it's cloud-based. I make a quick video, like you can send it in a text message, you can send it in an email. It is amazing, and I love it. So I'm so glad you like it. And
I really like it.
Wonderful. So one thing that we both know, that there's a lot of people out there right now looking for jobs. We know that there's record high unemployment.
Yes.
But there's also a lot of companies that are looking,
and it's competitive.
It is very competitive. So what would your advice be to anybody in any industry that's looking for a job right now? Like, they need the encouragement, they need some advice from somebody that's been in talent acquisition for a long time. What would you tell them?
I mean, I just think employer brand is where everything is at right now. And I love how you guys helped us, HR Maximizer, really tell stories. And because I think that speaks volumes. If you hear from people that are employed and they are happy and engaged. And granted, there's always one who's disgruntled or someone that hasn't exited the organization in a positive manner. But I really think the future is the employer branding. And I think people need to do their research. And for me, sitting in that lobby of these two healthcare systems was without anyone knowing who I was and just observing, helped me make my decision. And it's a decision that I'm still proud of to this day, 13 years later. So I think it's important to learn more about the organization that you're looking at and to talk to people.
Yeah, no, I agree. I think that anything that you can do to network with people, whether it's online, because we're clearly not going to be networking in person, that's very, very important. But I think that doing more research about the organizations that you are applying to, we call it like post and pray, when we post a whole bunch of job postings and just hope that people come to them. Mm-hmm. But we also know those people that are frequent flyers that we call them frequent flyers in talent acquisition, that apply for every job that we post. Or we call it like spray and pray. They post their resume everywhere. They send it to everything. It's not well done, and it's not customized to the position. A recruiter or a talent acquisition person knows that. So if you're truly wanting to be a part of an organization, do the research, take the time to understand the employer brand, and then make the decision. If I'm going to apply for this position, I'm going to spend a little bit of extra time. I'm going to, customize everything that I'm going to send to them.
Yes.
And really try to start off on the best foot forward. I also encourage you to connect with them via LinkedIn. Some people, not necessarily the recruiter, but connect with people in the organization. Ask them some questions on LinkedIn. I found that a lot of people are very willing to talk, via direct message on LinkedIn about their organizations or about what they like, or, if they could recommend anybody within the organization. I think that we have this amazing tool right here, with so many people that work all around the world in different industries, and we need to utilize it to to better our own careers and help other people in their careers as well. So
I totally agree. And then candidate relationship, I just had to give a shout out to the two people that work for me, because in the last 2 weeks, I've had several new hires say, you know, meeting your recruiters and developing a relationship with them totally reinforced why I want to work at Vail Health. And I'm just so proud. Cool. It's so cool because I know they're amazing, but to hear that feedback from several different new hires about both of them, it just makes me really proud.
I hope that Jody and Tori are watching, and if they're not, we'll send it to them.
Okay.
But they're wonderful recruiters. They're such personable people. I can imagine being a candidate at your facility and getting to work with them would just be a wonderful experience. You know, we believe that onboarding starts from the moment that you see a job posting and apply. And I think that they are wonderful ambassadors of your brand, for sure. And I think
they are, and they're authentic.
They are
real. And that's what I appreciate. It's the good and the bad and the ugly.
Yes. So I just want to thank you guys. Thank you everybody for watching. I want to thank Jaime for being here today. I don't want to go much over the 1 hour. I know it seems fast, maybe. I know. So to end out, like if anybody that's watching is interested in working for Vail, what should they do?
They should call me right now. They can send us phone calls. They could send us an email to recruitment@vailhealth.org. They could hit Jody, Tori, or myself up on LinkedIn. And I'm comfortable if you give them my phone number as well.
I'm not going to give anybody your phone number. You're super busy. Go to vailhealth.org. Yes. Go to the careers page, check out the recruitment videos. We have so many awesome videos of the amazing employees at Vail talking about what it's like to work there, talking about the culture, the benefits. I would encourage anybody that's watching, please go and check it out. I think that Vail has put in so much effort into creating an organization that people want to work for and into really working towards bringing in people that are going to stay. And that is so important for them. So please visit vailhealth.org, check it out, and let us know if you like all the videos, because they work really hard on creating those. So Jaime, what is your favorite thing? Oh, that one we already asked you. Sorry. Joe linked Jaime's LinkedIn right here on the comments. So if you're in here, go ahead and connect with her. Anybody that's watching, I'm sure she'd love to hear from you. Thank you guys all again for logging in. Thank you, everyone.
Thanks for having me. This was fun.
I'm glad. Do you think that that Tori and Jody would want to do something like this?
Yes, we'll get them on here.
Okay. Wonderful. Well, thank you so much, and have a wonderful day, everybody that's watching. Thank you again.
Thank you. Bye-bye.
Can we get a quick pose for the photo?
Yes. So Jaime, we have to just stay on for like a minute because the playback runs a little bit like behind, I guess, on LinkedIn.
Okay.
And so do you want us just to smile?
I just want a couple of poses. Maybe do like a